Welcome to the Birth Abroad podcast. My name is Megan Jennings, and I'm honored to host mothers who have come here to share their overseas childbirth stories. From fertility journeys to postpartum and beyond, this podcast is meant to hold space for women all over the world to share their unique experiences with the challenge of becoming a mother away from one's home country. Let's get in today's episode. Hey everyone, and welcome back to the show. In today's episode, I have Allison Mackey on. She comes from Canada and she lives in Sweden. Now, I know I have a disproportionate number of guests that have a connection to Sweden, and basically that's just because all of the people I know right now have a connection to Sweden. Either they live here or they're from here and they live somewhere else. So I'm working on it, okay? I'm working on getting my podcast diversified, so just hang in with me here. However, this is a very interesting story because Allison is going to tell us about her vaginal breech birth, and especially how very supported the whole event was. This is like really in contrast to what I think a lot of women in other parts of the world are used to, where most care providers don't even want the liability on their hands of delivering a breech baby vaginally. So that is why I feel like this episode is of particular interest. So it's a little bit on the longer side. I tried to edit out where I could, but there's just a lot of good content in general about, having a baby abroad. So I welcome you to grab a cup of coffee or a glass of wine or a cup of tea and sit back and give this a listen. Okay, thanks guys. Hi, Allison, and welcome to the Birth Abroad podcast. Thank you so much for taking some time this evening to sit down and share your story with us today.
Oh, thanks for having me.
So, before we begin, would you like to introduce yourself and maybe tell folks where you're from, where you currently live, who's in your family, that kind of thing?
Sure. So I am originally from Canada. I grew up in Toronto in kind of the central eastern part. And I also spent some time living in the US. My husband is Swedish, and we have a 1-year-old daughter named Nova, and we live here in Stockholm, in Sweden.
Yeah. Nice. So let's take a step back for a second and start with how you even found yourself in Sweden and when you and your husband decided to start growing your family.
Sure. So I guess it was around the end of 2014. We lived in Vancouver, Canada. So we lived on the West Coast together there. And as I mentioned, my husband was Swedish. So he was kind of feeling like it was time to move back home. We had been living in Vancouver for quite some time, and we were away from both of my family and his family. So we kind of felt like, okay, we've done this for a while, and now it's time to get closer to one of our families at least. And he was really feeling a drive to go home. So he started looking for jobs and actually got a job within his current company, or the company he was working for at the time, in the office in Stockholm. And so that was a really good opportunity for him, and it was a really well-known office section of the company. So he took the job, and then the decision was when he would start. So there was a lot of talk around that. And it was kind of put in a position that he would be like, okay, I'll start when Allison gets her visa sorted out, or when you guys can get her visa sorted out. So this was a company that deals a lot with immigration, and they hire people from all over the world. So we had kind of put our faith in them to sort out the situation. And they had said, okay, so it's early 2015 at this point, and we'll submit an application for Allison on her behalf to get a work visa or to be able to live in Sweden, and you guys can move over in the spring and you'll start in April. So that was kind of the plan.
And how did that go?
Yeah, not so well. Yeah, so it was, so we had actually given up our apartment and quit our jobs, or I quit my job and he was transferring in his, and his company actually shipped over all of our stuff. So we basically just kind of like took a plunge and moved. And I had at that time no idea that this was an issue. And so when we were supposed to move, my application was not even like process at the slightest.
Mm.
And it was really up to his company to get everything sorted out for us. So they were like, oh, well, just come over. You have 3 months to be here as a tourist,
Surely
and it
they'll
will
get it
get
sorted
done
by
then.
then.
Yeah. Yeah. So it didn't. And towards the end of that 3 months, I was in kind of panic mode and eventually applied for a job back in Toronto, close to my friends and family. And it was actually a really great job. So I was really lucky. And I applied and had my interview and told them, look, I'm not willing to dedicate more than 3 months at your company because at any point my application could be accepted and I'll be moving at the next day. And because of this, I moved back. Although I didn't really have anything, I packed a suitcase and lived from a suitcase on like couches and rented sublets for like a month or 2 months at a time. And eventually that it got extended from 3 months to 6 months to 9 months to like 12 months. It was actually quite traumatic. But eventually, in May 2016 was when I moved over legitimately. And yeah, and then since May 2016 is when I've been here in Stockholm.
Okay.
Yeah.
So after all of that, I'm sure you settled in to Sweden. When did the conversation arise that you guys were ready to take on a whole new stress?
Yeah, right. Actually, the conversation had been started well before then.
Okay.
We'd always wanted to have kids. It was never like that we would or wouldn't. It was more of a question of when. And I would say that my husband, Gustav, he was on board. He was really wanting to start a family as soon as we moved over. So he was like gung-ho to even, get going early. I, on the other hand, was not so keen on that. It was like pretty stressful, the whole immigration situation. And so it was kind of up and down where some days I'd be like, yeah, like, let's do this. We can just start trying now. And then other days I'd be like, no way, that's not happening. So, when we moved over, he was like, yeah, right away, let's start a family. And I was really not ready. Like I had moved over and I was like having a really difficult time with the transition. I felt like I was I think a lot of it had to do with the fact that it took so long to move over here and that it kind of felt like Sweden to some level didn't really want me to be here.
Right.
So I had a lot of like issues with that and especially not knowing the language and kind of all the struggles of getting a residency and getting all the documents I needed. Like I was really kind of in this kind of personal battle with Sweden as a country, which sounds really strange that I kind of personified the country, but that's how it was. And so I was afraid to kind of like become part of society to some level.
Yeah.
So I didn't I wasn't kind of mentally ready to take that plunge into familyhood at that time, or parenthood, I guess. So yeah, I don't know. And it took some time for me. I think a big part of it was learning the language and feeling like I could do things I could do things before in English because everybody here speaks English, but I still had this kind of mental like insecurity of going out and having to talk to people in English and ask questions in English. And I was afraid that somebody would come up to me and ask me a question. And so I just kind of felt like I really need to learn the language before I do anything. And so I felt really kind of lonely at first. And then eventually, as I started learning the language, it was more and more like okay for me to do things. And I felt a lot more comfortable.
Yeah.
So that really made a difference in my like mental health and how prepared I was to take that next step into familyhood. And then also I was in a very unstable place with my job. It was a casual position, so it was never really anything permanent. Yeah. So I felt like I wanted to really settle down first before getting pregnant. So I got a position I'm a PhD student now at Karolinska Institute, which is a medical university here. So I'd always wanted to do my PhD, and this position came up in a project that was really interesting, and so I took it. So then there was also that kind of hesitation of, well, I don't really want to get pregnant now because I just started a new job, and So there's
Like they
always
say,
something.
there's never like a right time.
Exactly. There's always something in the way.
Mm,
There's never a perfect time. So yeah, so then there's that. And actually it ended up being that one day I had just gotten so frustrated with a meeting that I had in with regards to a project I was working on. And I was like, this can't be my whole life. Like my whole life cannot revolve around my job and my career. And I was like, nope, this is it. Let's do it. So it was like pretty quick decision from being like unsure to being pregnant. So, I mean, coming from Canada, and I think from what I know, Canada and the US have quite a similar model of care for prenatal and as well as birth and delivery, in that you generally have your physician or an OB take care of your appointments. And here it's a midwife-centered approach. So, I mean, a midwife-centered approach for normal or non-risk pregnancies.
right.
So for me at the beginning, it was pretty, I didn't have any risk factors. So yeah, I called a clinic, a midwifery clinic, or what's called an MVC here in Sweden, to book an appointment. And I was actually quite surprised how long I had to wait. I don't know if you felt the same thing. I mean, you actually started in the US. But
Well,
here,
for my
starting
first,
from,
yeah.
right, that's right,
Yeah.
yes. So I don't know. I mean, I imagined having an appointment right away to go in so that they could do something to confirm. I mean, I had just, like taken the stick test. Like, what is this? It's just a line on a stick. So
Yep.
I wanted them to be like, yes, you are pregnant. But they were like, no, you have to wait, all this time. And I was not prepared for that. So that was kind of,
How long did they make you wait?
oh, I don't remember, but it was like a couple months.
Yeah. Yeah. It's like, it seems like most of the first appointments here, like the inskrivningen, I think is what they called it, or
Yes.
whatnot,
Yeah.
is
Yeah.
somewhere between like 10 to 12 weeks.
Yeah.
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 Into pregnancy,
Exactly.
which is crazy. Well,
Yeah.
compared to what I'm, used to in the
Yeah.
US.
Me too. Yeah, exactly. So I was like, how am I supposed to tell people or like my family that that I'm pregnant without you telling me that I'm
I know, right?
pregnant?
But that's actually an interesting point because, and I'm sure, well, I don't know, maybe you feel the same way. I feel like at least in the US, pregnancy is sort of like this medical condition that needs to be monitored. There's nothing intuitive about it. You need a doctor to be monitoring you and telling you that, things are okay or things aren't or whatever. But here, it seems like it's a very natural, intuitive, like trust your body, let nature do its thing kind of
Yeah.
situation.
Yeah, I definitely felt that as well. And I knew that coming in that was the way it was.
Yeah. So did you have any like gnarly first trimester symptoms, or how was that for you?
Um, yeah, I mean, not comparative to other people and what I've heard from others. I had a pretty easy pregnancy actually overall. It was like really normal. And these appointments that you would go in and visit the midwife, and it was very short, just asking how I was, and nothing really was unusual. I mean, I was a bit sick, but I wasn't like disabled because of it. I was just felt a bit nauseous at times and was sick a few times, and that was really it. So generally everything was going really smooth, and I think I was really lucky in my pregnancy and how well it went. And then towards the end, it was, similar, like just normal kind of symptoms with back pain and foot pain. But I worked out like until the very end. I was doing yoga up past my due date 2 nights a week. So I was trying to keep quite active, and I was also, I think, really lucky in how well I was able to go through my pregnancy. Yeah.
So, but you had an interesting detail about your pregnancy.
Yeah. So everything was really, really good. And I was really comfortable throughout the pregnancy. And I mean, going back to your comment about being prepared, my midwife did not speak English. So I spoke Swedish throughout the whole thing. And it was really, I think if I had not been so careful in how much I wanted to get into this society beforehand, it would have been a very different experience. But for me, knowing Swedish and being able to understand things with her was like total key. So When I was in my third trimester, I started researching about the actual birth. And prior to that, I was really into pregnancy, and I was, keeping up with the app and what was happening every day, and just being really absorbed in the pregnancy itself. And then towards the third trimester, I guess getting into the third trimester, I became like, well, I should probably figure out how to do
like,
this.
oh yeah, this has got to come out of my body too, right?
Yeah. What's the next step? Now that I'm like super absorbed in how big she's getting, I'm like, she's gonna need to come out at some point. So I started doing research into like the delivery process. And as I mentioned, I'm like a PhD student, so I kind of have research-oriented brain, and I love doing research and finding out everything there is to know about everything. So I started looking into different methods for pain, and about the advantages of a birth and the natural birth, and how awesome it is to give birth, and the endorphins that go into the process, and the microorganisms, and like going down to the really specifics of all the sweet advantages of giving birth vaginally, and also how to deal with the process and the breathing mechanisms. And I was even getting into like hypnobirthing and those techniques. And I became really kind of like excited for the actual delivery, which is kind of, I don't know, kind of weird. I think a lot of people are not excited to go through such a huge amount of pain. But I was really into it. And they have this thing here in Sweden that's, I think it translates to like birthing without fear.
Yeah.
And it's, it's become kind of, it's like,
is it a
called?
Class too? Because
it's
I only read the book. Okay.
Yeah, it's also a class, but it's recommended
kidding.
by all the midwives to read and to look into the process. And they talked about it a lot in my prenatal yoga classes. So a lot of the techniques we actually used in yoga. And so I was kind of like getting really mentally prepared for delivering. And like I said, I was pretty excited. And I was also kind of excited, not just for meeting my baby, but also through going through the process of like conquering the pain, if that makes any sense. Like,
yes, it does.
I was just kind of
I was the exact same. Yeah. Like I was really excited to feel like what all of my ancestors felt, and to actually feel what it feels like to go through this crazy, life experience. I was also really, really excited both times.
Right. Yeah. And I think that there's a lot of, change happening with regards to that. I think that like, it's not just about getting through the process, but it's also about what you get out of the process.
Exactly.
And I think that that's now becoming more of a conversation in like birth and delivery, is like what it is to you and how it means to you as the mom, as the woman going through the delivery. So,
and there's like this beautiful word, I think it's like matrescence. I'm probably butchering that, but it means the birth of a mother, and it acknowledges the fact that a baby is not just being born, but a mother is also being born, and there's that whole transition there too.
Exactly. So that's kind of where I was, and then as we were getting close to the delivery date, I think it was around, well, she was born in September, and so it was like towards the end of July that they were starting to tell us her position, and she was sitting breech, and then, but at that time it was kind of no big deal. Like, yeah, she's breech, but
she's got plenty of time.
She's got lots of time to turn around, and she'll turn around, and she'll turn around, and wherever she wants to be, she'll be. So that was kind of the deal. And at that time, and then even getting closer to the end, it was appointments became every 2 weeks. And then at 36 weeks, she was still at breech. And they said, okay, well, we'll have another appointment next week, which you technically wouldn't have, but we'll have that, and just to make sure she's turned. So it was then at 37 and a half weeks, and she was still breech. So they booked us an ECV, and an ECV stands for external cephalic version, if I'm not mistaken. And that basically means that they are going to try to, it's a version being like upside down, cephalic being the position with the babies in with the head down, and then external being that they're actually doing it from the outside.
Oh, fascinating.
Yeah, and the Swedish name for it, which I have to say because I think it's amazing, is vendingforsök, which is literally translated to turning attempt. So it's like
I love how
literal
Swedish is.
So then we were scheduled for this ECV, and of course in my research mind, I go in before the appointment and I look up everything there is to look up on ECV. And I watch YouTube clips and I listen to different podcasts and everything, and read articles, of course. And 50% of women that have an ECV have a successful turn, or their baby turns successfully. But that does not mean that your chance of having your baby turn is 50% or 50-50. So because there's so many individual factors that go into it. So like if you're a first-time mom, your chances go way down than if you're a second-time mom, which is a much higher chance of your baby turning. And then the other consideration, of course, is like your uterus, but that's not something that can be really measured. But then if your baby has been sitting in breech for most of the pregnancy, then your chances also go down. And I was pretty confident that ours was sitting in breech, at least since the ultrasound. So that's, pretty significant amount of time.
Right.
So I was pretty much guaranteed, like I was going into this procedure really pessimistic that it would work because of
what
those
are the
odds.
risks associated with an ECV?
I don't really remember, but I think there are risks. I think that they do a lot of control of like the fetal heart rate to make sure that there isn't any issues. I think that they are very cautious and they don't do anything that they feel, especially here in Sweden, they don't do anything that they feel will be too much of a risk to the baby. Right. So in my experience, it was like they did a try. Okay, that's it. It took maybe 10 seconds and it didn't work. And so I think, when I watched all these YouTube videos, it was like a huge process and they had, lots of time, and it was like, okay, they tried again. Okay, they tried a different way, and it was much more intense. Whereas for me, it was like very quick and very easy to give up.
Do you feel like they did like an adequate attempt?
Yeah, I think I kind of put my faith in that they did what they needed to do, and I think perhaps they had the same kind of pessimism in mind that I did. That this is a first-time mom. And, they asked me how long she's been in breech like that. And I said, I think she's been in breech pretty much the whole time. So I think they went in being like, okay, this is unlikely that she's going to turn. So I don't know if that made any kind of difference in how they did the procedure. But I think also, that they did explain to me, like, we tried and she just refused. Like, she was not going to turn. Like, I think that they were pretty much confident that she was not going to turn. So
I feel like I know the answer to this question, but were you also trying to do things on your own at home, like spinning babies or whatnot?
Yeah. Oh yeah.
What did you try out?
A lot of time on my head the last weeks of that. Like a lot.
What do they call that? The leaning forward inversion or something like that?
Yeah, something like that. Yeah. So basically you like hang yourself off the couch and like, and like everything. Yeah. Just like sitting in like, just lying like with your bum up in the air as well. Like just lying there and trying to get the baby to turn. But yeah, the inversion on the couch was one that I would do a lot.
What about chiropractic care? Because I think I had read a post of yours in one of the baby groups about looking for someone who could do the Webster technique. Was that you?
Yes.
Did you find anyone?
I did not, because I looked a lot and I called like a ton of chiropractors and they didn't even know what it was. So it's not a thing that's done here. But there was somebody that was a masseuse who did acupuncture, and I didn't actually end up calling her at that point because I kind of also felt what the doctors had felt during the ECV, that this is really not happening. Like, she's been here the entire pregnancy. We tried to turn her around. She wouldn't turn with push, and there's just nothing that's going to happen. So after the ECV, I couldn't find anything before the ECV to get chiropractic care or acupuncture to avoid the procedure. And then after the ECV, I was like, it's just not happening. I mean, she's just not going to turn. And before the ECV, I started doing, well, in my research, I started doing a lot of, or hearing a lot of things about just, okay, it's either she turns or you have a C-section. So that was kind of in my mind. And I didn't really know that there were any other alternatives than that. It was just, this was it. Like, if she does not turn during this procedure, then that's it. Like, all this kind of wishful thinking about giving birth is over. And I think I came to terms with that. I was more coming to terms with that, I think, than the actual ECV itself. And I wasn't really too worried about the ECV. Like, I think that there's, researching it, there were a lot of people posting things about anxiety going into it, but I wasn't really too concerned about the pain during that. It was more about, okay, well, if this doesn't happen, I have to do a C-section. So yeah, that was how it happened.
But did that dialogue occur with your midwife before the ECV, or when was the discussion brought up about how you, like, what your options were to give birth?
No, we didn't discuss the birth plan. Well, no, I should say that the birth plan was created beforehand for a regular vaginal birth, but it was kind of on the assumption that she would eventually turn. This was done weeks before, I believe. And then as she was nearing the end, or towards that 38-week point when the ECV is done, there wasn't really much discussion from the midwife. It was really like, just what's the next step? So there wasn't anything discussed. And it was just through my own research. And of course, when I do research or when I look stuff up online, I should say it's more like Googling than research. It's all done in English. So like, I get the North American perspective on things, which is not always the best thing. I don't really see how it is here. I see what it is. And it's really hard. And sometimes I try to Google things in Swedish, but in Sweden, the population is so much lower that you don't have all the topics or all the answers that you want. So there's much more information available in English than in Swedish.
That's such a good point. And I didn't how that totally bias your search results.
Exactly. It definitely does. Yeah. So I went into the ECV, and that experience was interesting, I should say. Like, there's a lot of talk about how painful it is, and, do you get an epidural for an ECV? For me, it was not painful. Like, it was as painful as somebody just kind of coming up to you and pressing on your belly, like a massage. It was like a very intense massage. So it was quick, and it was her really pressing down on my belly. And I think the worst part of the ECV was my husband, who sat beside me screaming the whole time.
Oh no!
Because for him, it was like, I mean, I had my eyes closed, or I wasn't looking down at my belly, and they actually like invert you a little bit, so your head is kind of facing backwards. And so I was like not really looking at anything. And all he saw was like this doctor coming in and like pressing down really hard on my belly and like trying to shift the baby around. And so he was like screaming, like, because you can see the outline of the baby's head as she's trying to like press it around.
Oh,
so
crazy.
Yeah, so that was pretty crazy for him.
Huh.
That was the ECV, and it ended up being like not successful. So afterwards, the physician who was performing the ECV was like, okay, this is, unfortunately, this isn't, she isn't going to turn. So we should talk about the next step. Do you want us to bring in the OB, who is part of the breech delivery team, to discuss with you the option of a breech birth? And
so they were the ones who suggested it.
Yeah, it was the ECV obstetrician that was doing the turning attempt who suggested that I talk to somebody about it. And I didn't even think that it was an option. Like, I had been like, this or C-section. And so I was like, oh, well, I don't know. Like, do we want to talk to her? Like, what does that mean? Like, is she busy? Is she too busy? Because I wouldn't talk to her if she's too busy. And they were like, no, like, I mean, I just had no thought that this was kind of an option for us. And so the physician was like, no, like she'll come in and she'll just discuss with you the options. There's no harm. So, okay, no problem. So she came in and sat with us for probably about half an hour, 45 minutes, and talked to us about the possibility of delivering vaginally. So it's really interesting to me because, I mean, just from the experience of how we got this information delivered to us in North America, when I've listened to podcasts later, it's the mom having to seek out somebody that is qualified to deliver a vaginal birth and willing to deliver vaginally for a breech baby, and having a lot of difficulty doing so. And for me, I was like, okay, C-section. And then this opportunity came up that I hadn't even thought was possible, just delivered to me in front of me, like, here you go, here is another option for you. So that was really interesting how that was approached from this kind of perspective.
How did the doctor describe it to you? What did she say the protocol was?
So the protocol itself, so basically they, at this particular hospital where we had decided to deliver, they had a breech team that was specifically trained to deliver breech babies. And the team was made up of 3 OBs and 3 midwives, I believe, that are on rotation, so that there's always 1 OB and 1 midwife available 24 hours a day for breech delivery. And because of that, you are basically guaranteed a spot at the hospital to come in and deliver your baby. You are, as opposed to the normal care that they have here in Sweden in terms of the delivery, you have a set physician and a set midwife. So typically how you would give birth is that you go into labor and you go to the hospital, and who's ever working is the one that delivers your baby.
Right.
Where that's very different than how it is in North America, where you have a physician and, or perhaps a small team, and one of them is delivering your baby, but you've met them before and they're your ones following you throughout your care. This is very different, where you go into the hospital and the midwives at the hospital are the ones that deliver babies, whereas the midwives that you have your prenatal appointments with are the ones that deal with prenatal appointments. So they are qualified in their own kind of unique place. Yeah. So this was a bit different, where I will have met the physician and there'll be a physician there during my delivery, which is also different. So I'm no longer considered non-risk. Now I'm in the risk category if I were to take vaginal. The other procedure is that they have a very strict regulations of who qualifies for delivering vaginally. One of them being that you have to have a certain hip width, and that's done through an X-ray. So they measure your hips and make sure that you have big enough hip to be able to deliver. They also make sure the baby is not too big. And the big one is that the mom, you as the woman, have to be totally on board. So that's kind of, if you are unsure about this, and that if it causes anxiety for you to deliver vaginally, then you are no longer a candidate for a vaginal birth, basically.
Very interesting.
Yeah. So that was kind of the criteria that we had to go through, check, everything was okay. And the one other thing was that you can't go past 41 weeks and you cannot be induced.
Okay.
So there's all of these rules, and the reason is for all of these rules is that there are certain risks to delivering vaginally to the baby. And so if you don't meet one of these criteria, then the baby is at risk if they're delivered that way. So in order for the birth to be, as risk-free as possible, you have to meet these criteria. And so we had a really in-depth discussion with this doctor, and she was fantastic about how much information she was willing to give and how in-depth she went into the details of the pros and cons about delivering each of these two methods. And of course, the big con for cesarean being that it's a major surgery. I mean, it's not, it's not like stitching up a wound or like a cut. It's like a serious major surgery. So that's something that you have to live with and have perhaps have complications or issues down the road with if you were to have another child or whatever. Like there's a lot of other things to deal with if you have a cesarean. In addition to the post-surgery recovery time interfering with your first few weeks of your baby's birth. So there's all these things that you do have to think about with a cesarean. It's not just a simple surgery. It is a major surgery, even though it's a very common major surgery. So there's that major con to doing that route. And so I thought, okay, well, if there's this ability to avoid surgery, and if all the criteria are met through, making sure that the risk is minimized through delivering vaginally, what are people doing? Like, you're offering this to everyone that has a breech baby that could not be turned. Like, what are people accepting? And she had said that actually only 20% of Swedes at the hospital accept vaginal.
No kidding.
So it's a very low number. And that surprised me. And it was like, I don't really understand that. Like, why? And I think the big thing is because people are not really understanding the benefits of birth versus the consequences of a cesarean. And it is in people's minds, like it was in mine, that if your baby is breached, you have a cesarean. And so that kind of is set. And when you are proposed with this option of having a vaginal birth, it doesn't make sense to people because, of course, you have a cesarean if your baby is breached. That's what people do.
And there's so much fear around such small percentages. I mean, I know
Yes.
I'm in no way like qualified to make any kind of medical statement, but if you read the literature, the percentage of something going wrong if the midwives and OBs actually follow the protocol of delivering a breech baby, they're so low,
Yeah, no. And there's also, I mean, historically, I mean, going back many years, it was that all midwives or workers who delivered babies, physicians, midwives, whatever, delivered breech birth as well. And that was just part of their repertoire of what they knew and what they learned. And, it's quite a high, I mean, I think it's like 10% of babies are breached. So it's not that unusual, but it does require a certain skill set. It's not, you have to know as a physician what to do in certain situations,
right.
or as a midwife. So you have to be trained to deliver a breached birth. Like it's not something that it's not the same as a head first delivery.
Right.
So, but that was always the case that midwives had been trained to do so. And actually over time, as people started to not really consider the risks that are there without taking all these extra precautions that my hospital does, or the hospital I delivered does. There are more risks to a breech delivery than a normal delivery. And then it was actually a study that had come out in the late 90s, late 90s, I believe, or maybe 2000. There was a big study that came out that was a randomized control trial. So basically they took women and divided them randomly into whether or not they'd be delivering vaginally or via C-section. And this was women with breech babies. And they found through this study that those that were delivered via C-section had there were less consequences to the baby. So there were better outcomes with babies that were delivered via C-section. And that study, it was one study that was done, and it was a big study and a well-done study, but it was only one, and that really changed how care was done for breech births all over the
I've
world.
heard of this study. I think I heard it mentioned in a birth hour podcast. Now that
Yeah.
I think of it, because
Yeah, and
yeah.
it was significant. And actually, the OB that came and sat down with us, and this was one of the things we talked about because I was really wondering that this question of if the facts are there and if you take all the precautions, why are people not doing this? And this was one of the big reasons, and this was one of the big reasons why people's opinions as to what they want to do changed, because this study is showing if you deliver vaginally, you'll put your baby at risk. And that's not the case. Like that's not just what this study had kind of concluded. But I think that there's a lot of issues to the study. There's a lot of problems with the design, and that these certain risks that are present are being accounted for. And this is why there's such strict criteria with eligibility for delivering
Right.
vaginally.
I was going to ask, does that study take into account like the X-ray of the pelvis and such?
I don't recall. I'd have to reread it, but I think that there are some methodological issues with how it was done because the women were randomized. So
Right.
there was probably some screening that went on, but I don't know in which way or in how the depth that it was performed.
Mm-hmm.
So I'm not too sure. But one of the big things is that whenever you try to make decisions in healthcare based off of studies, the literature is really good at showing group differences. So especially, randomized control trials that are quite high level of evidence, that they show, if you take this group of 1,000 women, this many have issues in this group if they do this intervention, and this, X number have issues if you do this other intervention. But what it doesn't tell you is how you as an individual would benefit from one intervention or another. There's so many variables, and if you as an individual were to take one intervention that perhaps isn't the best intervention for an entire group of 500 women, that doesn't mean that you will have bad consequences.
Right.
You could have great consequences, particularly, as you said, if you meet certain criteria to have the best outcome for a certain thing. But anyways, after discussing with this doctor about these options, I went home and I pretty much changed my PhD topic because I read so much, not literally, but I mean, I just read so much about this topic, really diving into PubMed and getting out all of the literature about it.
I was going to ask you if you were abusing your ability to access paid.
Oh, for sure.
Yeah.
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 Yes. I was I had a folder on my computer of PDFs of journal articles. But so in the end, we didn't have that much time to decide. It was 38 and a half weeks at this point. So we had only about a week to make a decision. And while we were there at the appointment with the physician, with the OB, she asked if we want to at least go through the screening steps. So this being the X-ray, and then ultrasound to measure the baby's size. And there was really no risk to that. And she said, even if you change your mind, it happens a lot that people do this and they change their mind. That's okay. As long as we get these measurements before you go into labor, then we'll know that it's safe or not. So we did that. And while we were doing that, we made this decision to go ahead and pursue a vaginal birth if we could. And I'd say that the support that I received from the hospital was absolutely incredible.
Can I ask what hospital this is? Because I imagine there may be some people here in Sweden that might be interested in, finding the same healthcare team that you had.
Yeah. So they were at Södersjukhuset, which is on Södermalm in Stockholm. But I also should say that they did discuss that, this option is available in other hospitals. So it's not just this hospital that performs breech delivery vaginally. There are other hospitals, because they had mentioned that they are the only hospital that has a team, a rotation team. So I think they do it differently how they actually set up the schedule, because not everyone is qualified. Like I said, it does require some training and some experience. So they do keep a small team of people that do it, because there's only, I think that they had said from my hospital, they have only 30 deliveries a year. So it's quite small. So they keep a very small team of people that are trained, so that they do the deliveries all the time, so that they can get the experience and the practice. So yes, it is available in other hospitals as well. And actually they are trained because they went to Norway to be trained to deliver breech. So technically, I mean, as I had mentioned, like there was this huge drop off back in the early 2000s of midwives and OBs being trained to deliver breech because of this big article that came out. And since then, midwives are no longer practiced at doing so because the default is a cesarean. So you have fewer and fewer midwives that can actually deliver breech. And so when it was pretty recently that in Sweden, at least in Stockholm, they had decided that this was a skill set that needed to be reactivated in their team. And so from the hospital I delivered in, a small team went up to Norway to be trained on how to deliver breech. And they, in Norway, never stopped. So it was one country, of very few countries that never stopped delivering breech babies, whereas others decided this was no longer a skill set that required training. And so one of the stipulations, I should say, about delivering breech was that I would have an audience.
No pressure, right?
Yeah. So normally you typically have the midwife who is working that particular shift, and perhaps another midwife, and perhaps a nurse assistant. So max 3 in the room with you. I had maybe 6 or 7 people. I don't really remember how many were there, because there were quite a few. There was the OB, there was the midwife, and then there was a training midwife, a training obstetrician, the assistant, and then I think one other person maybe. But I would say 5 to 6 people in the room watching and learning. But for me, it wasn't a big deal. So we went forward with that.
Let me ask you a couple questions. Now, I'm probably getting a little ahead of myself, but this one is just out of curiosity. What type of breech baby did you have?
Now I forget the terminology for it. She was sitting.
Was it Frank breech?
No, it wasn't a Frank, because a Frank breech is where she has her legs up, like she's sitting in like a pike position.
Butt first. Yeah.
Yeah, she was butt first, but she was sitting cross-legged.
Okay.
So it was the optimal position.
Okay, well that's awesome.
Yeah. Yeah. So that was no problem. And actually they weren't really too concerned. I mean, there was one position, and now I can't remember. There was one position where it was kind of, oh, that's not the best for her to be in. But the other, like Frank, was okay, and then this one that she was sitting in was pretty optimal. So yeah, that was not an issue.
And then you said that they said that one of the stipulations was you couldn't be induced. Did they say anything about your ability? Now, I know that you wanted to have I'm assuming you wanted a medication-free delivery, like no
Yes.
epidural. But if you were one to have wanted an epidural or, whatever they give here in Sweden, would they let you have it, or did you need to maintain the ability to move in order to do this safely?
So I guess so 2 answers to that question. There was no so I couldn't be induced medically, but I could do other things to help get started. So I actually went in, every 3 days, I believe, to see the OB, and I would have a sweep done.
Okay.
So she tried to get me started, so that I wouldn't reach that deadline of 41 weeks. But having an epidural wouldn't affect being induced. So I couldn't have any medical induction, but I could have an epidural if I wanted to. So that was no problem.
Okay.
And I think one difference being that here, when you have an epidural, you can move.
Yes.
because I do need to move. And that was the big thing, is the position. And it was instructed how I would actually deliver the baby, in which position I would be in. Because, in a normal delivery, you can choose where you want to be and what's most comfortable for you. You can be on your back or your knees or on the ground or on a birth stool or whatever it might be. For me, I had to be in a certain position. I had to be up on the bed, on my knees, with the backrest up, so leaning over the back of the bed. So
With an audience in the room.
With an audience, which was actually not so bad because I couldn't see anyone. So,
okay, well, there you go then.
I was like, I was in my own world for most
Ignorance
of that
is bliss, right?
experience. Yeah. So that's why I don't really know how many people were there, because it was kind of a blur. And I didn't see anyone. I only saw my husband who was beside me. So yeah. So that was fine if I wanted an epidural. And I actually was not, and I knew that this was the case going in. I knew that the epidural here was not the same one as the one that I would have gotten back in Canada. So I was totally on board to have an epidural. Like, it was not an issue for me. It was like, I will, if I need it, I'll take it. Like, it wasn't in my birth plan that I would have an epidural from the beginning, but if I want an epidural, like, by all means, give it to me.
And then, just to interrupt, for people who aren't aware of like the Swedish pain management system, they give walking epidurals, which is a different concoction of drugs, if I'm not mistaken, and at a lower dose. So really, it just kind of like takes away the pain of the uterine contractions, but for all intents and purposes, you still feel like the delivery, you maintain the sensation in your legs, you don't need a catheter, which is really nice. So it's kind of like a win-win if you want to go that route.
Right.
So what day did you actually end up going into labor?
Oh, let me think. So she was due on a Sunday, and it was Wednesday that I went into labor.
Okay. So what was that all like? Tell us about it.
So let me think. I went into labor at about 1:00 in the morning, and I had I had no pre-labor or anything like that. It was like, it went from 0 to 100, very, and so I went to bed thinking like, oh, I'm gonna have a C-section, and I got up at about 1:30 and started kind of feeling like a bit of pain. And by 2:00, I woke my husband up, and I was like, this is happening. So he called the hospital, because in a normal situation, you try to labor as much as you can at home, and then go into the hospital when your contractions are within a certain time. But for me, it was different. So they had wanted to monitor me from the beginning, or pretty early on. And so they had said, try to come in before things get to that point. So don't wait too long. Don't wait as long as you would normally wait. And they have a room reserved for me. So I had kind of the luxury treatment when it comes to delivery, because I had this kind of quote unquote risk situation. So I needed to be delivered at that hospital because I had the team at that hospital. And how it works in Stockholm is that you decide on an optimal or an ideal birth hospital, but there's no guarantee that you will actually give birth in that hospital. So when you go into labor, they say to call in and discuss your symptoms, discuss your situation and how you're feeling, and how often your contractions are, and how severe they are. And they will kind of determine where you're going to be. So if you decide to be in a certain hospital, and they have a number of kind of labors on the way, or a number of women on the way, and then some other women that had called in that are further along, they're going to send you to a different hospital. So there's really no guarantee, and I think that there's quite a few that are transferred to different hospitals.
Yeah.
So that situation is very likely, and in my situation it was not, because I was guaranteed to have one of these breech team members delivering the baby. So I was guaranteed a room, and I was guaranteed a room anytime I wanted, which was pretty sweet. And so we called the hospital. You also hear a lot about hospitals saying, don't come in until you are ready to give birth, pretty much. Like, it was very different in my situation, where they really were open to us coming in as early as possible. And I think a lot of it is because of that fear factor as well that you had talked about earlier, where not only did they want to monitor to make sure that the labor is progressing, but also I think they want to give me that security that we are here for you if you change your mind, basically. If this is something that you are totally anxious about, we can do something about that.
So supportive.
Yeah, really supportive. I was very comfortable in water while I was in pain just during my last trimester, and just my back pain and foot pain. I would have a bath every night, and I knew that this was my way of pain relief. So I had said that, I would prefer to be here, and I'll sit in the bath for a while until things start going, and then we'll come in. And they were like, great, this had just started. This was like, 20 minutes after my first contractions. So they were like, yeah, okay, like no problem. Just keep us updated. Call us every 3 hours or so.
And how did that go?
Well, so I had, I guess they said call us at 5, something like that. So it was 2:00. Yeah. So call us every 3 hours. So I sat in the bathtub, but my husband went back to sleep because I was like, this is going to take a long time. Labors are it goes a long time, and you need rest. One of us needs to be rested. So I had a bath, and I was like, as I mentioned, I went from like 0 to 100. So I didn't have any of these like mild contractions. It was pretty hard from the beginning, but I was in the bath and I was doing well. And I got out at about 5 o'clock, and then I woke my husband up because things started to get pretty drastic. I called the hospital, and they said, okay, come in. And we came in, and by that time it was about 6:30. We went straight to the room, and the team came in, the midwife and the doctor. And the doctor was the one that I had initially met with. So as I mentioned, there were 3 doctors on this breech team that were on rotation. And this doctor I had met with initially, and I actually had met with her 2 other times. Oh, nice. Because as I said, I went in quite frequently to have sweeps, and they were absolutely amazing in how much information that they were willing to give and willing to share, and how much time they were willing to give me during these appointments. And I think that was also something that was really different, because the way that they have the model of care here, where midwives are responsible for low risk deliveries and births, and you have the obstetricians responsible for the high risk births. You have then these obstetricians with a very unique and specialized skill set, and have much more time and kind of passion or devotion, I guess, to the patients that they have. Mm-hmm. So I felt really taken care of by the OBs, and they were really willing to sit down and spend as much time with me as I needed to feel comfortable about going through this procedure. And that was fantastic, because I don't think you would find that in anywhere in North America where an OB would sit down with you for 45 minutes to discuss a procedure with you that you might or might not have based on your own decision. And they were really motivated, and there was definitely motivation on their part for me to take this route. And, I think a lot of it is the fact that they do believe that it is the lower risk, more natural, better route to take. But then there's also, you always think about, other motives, like, yeah, a cesarean costs money.
Exactly.
And that's money to a social system. That's not money to an insurance company. In contrast to the US, where the hospital might get more money for a cesarean, the hospital loses money when they do cesareans in Sweden. So
Very good points.
I think that there's also motivation in that sense, that they are very motivated to reduce the number of elective cesareans in general. So we saw this physician who I met with 3 times, twice to just go over a lot of the details about the procedure, and then once for a sweep. And she was there, and she was actually the one that ended up delivering my baby. But so I was really happy to see her, because I thought she was just absolutely fantastic. And then a midwife. So there's a midwife and an OB that's taking care of me during this time. And I ended up coming in at 6:30, and there was a staff change at 7. So I didn't actually see anyone until about 7 o'clock when they came in and checked me. And I talked about, all the different things that are you would talk about when you're getting ready to deliver, like with the pain relief that I'm interested in, and what the process is going to be from here on. And I think it was about 7 when the midwife checked me, and the doctor actually had been there for the whole night shift. So she was actually off duty, but she had wanted to see me again. Or she was there, she was off at 7, but she came in to see me for that appointment before the next physician came on. And she actually checked me, and at that time I was 5 centimeters dilated. And this was at 7 o'clock, so it hadn't been that long since I had woken up from pain.
No,
like it was pretty
6 hours only.
Yeah, only 6 hours, and I was at 5 centimeters. And so I had a feeling that something was happening, because all of a sudden she was like, "I'm just going to go to my to a meeting, but I want to check you again at 8 after my meeting." So she went into a meeting at 7. And she's already off duty at this point. So she's sticking around. She comes in at 8 and she checks me, and I'm 10 centimeters.
Holy moly.
Yeah. So it went really fast. And I should say, so another thing about giving birth a breech is that your labor has to be progressing. So if your labor is not progressing, you can't induce, you go for a C-section. So I was really happy that this was happening, because there was no chance that this labor was not progressing. And it was funny because when we went in at 7 and it got checked at 7, my husband was like, "Okay, so what should we do? Should can I have a nap?" And she's like, "No, this is active labor. Like there's no napping." So yeah, at 8 o'clock I was 10 centimeters.
What did you do between 7 and 8? Like what position or were you in, or what were you doing?
I was not doing too much. I was pretty like, okay. And actually somebody had come in at 7:30 to talk to me about what I wanted in terms of pain relief. And I was like, I'm doing all right. Like, obviously the contractions were very strong at that point, but I was like, it hasn't been that long. So I'm doing okay. Like I was just kind of moving around, lying down for a bit. An hour went by really fast because you basically count the time between contractions. So it's like, yeah, it was pretty quick. And my husband went out and got breakfast. So he was like gone for a bit and came back. And then it was 8 o'clock, like really quickly. But yeah, so at around 7:30, she came in and asked like what you want. And I said, okay, well, I think if this goes on for a really long time, I'll be open to an epidural, but for now I'm okay. And then soon after she checked me, I stood up and went to the bathroom and came out, and I was like really feeling pressure. It went from like nothing to a huge amount of pain. And they had said, okay, your water is going to break, because they had checked me from there. And I was like, oh yeah, like that hadn't happened yet. So I, all of a sudden they put down like one of those little like padded absorbent pads on the ground, like a little square, kind of like a placemat type pad on the ground underneath me. And in a couple seconds, my water just kind of burst, and it broke. And it was like a humongous splash. And it was like what you see in the movies, where all of a sudden a balloon bursts and like it just becomes this like swamp under you.
The last person I interviewed said it was like having a fire hose between her legs.
Yeah. Yeah. And it was like, I mean, I expected it to kind of, you kind of feel like a trickle, and it just kind of keeps going. And this was not that. It was it just all came out at once. And then it was over. And then I felt the pressure kind of was relieved for a very short time. And I got up on the bed and started pushing. And, I felt that push,
reflex
kind of
or whatever.
Reflex, that innate kind of like, I need to push. And so I did. And I did not really know how or what or when. And they had said to me that, with a breech baby, you just it really is like a lot of hands off for them,
Yes.
if possible. So you kind of just wait. They kind of just wait for a need to intervene. So I pushed, and actually going back just a step, I actually, when the water broke, her foot came out, which was really an interesting feeling.
Yes.
Because I was in that position in between, like, I'm pushing, or in between like the water breaking and having the contraction of needing to push. And so climbing up onto the bed, I actually had like a little foot hanging out of me, which was so weird.
Oh my gosh.
And I still remember
Did you,
that,
feel
that
her
sensation. Yeah, no, she wasn't kicking, but I could feel the sensation of having her foot just there. And my husband saw this little foot dangling out, and he was like freaking out about it.
Oh my gosh.
Yeah, so
You fly on the wall.
yeah, it was so strange. And they were trying to like hold the foot in. I remember being like, this is just so like out of this world, as I was trying to climb up in this specific position that they needed me to be in. And everything went so fast. So my water broke, and as my water was breaking, they checked me and at 8. My water broke at like 8:05, and or at 8, I don't know, 8:07, and like then I climbed up on the bed at like 8:10, 8:14, and so everything was happening like super, super fast, and they hadn't prepared for anything. So they came in at 8 and checked me, and all of a sudden they were like, this delivery room is not prepped. So there are people just freaking out and like trying to make up the bed and trying to get all the equipment in that they needed, and it was just like chaos for those 10 minutes. And then it was like I needed to push, and I didn't know who was there behind me, like if there was anybody ready to like catch the baby. So I just started pushing, and then my husband was like about to faint. So there was like all of a sudden the nurse that was supposed to be taking care of me was taking care of him. So it was just kind of very chaotic. And I was pushing, and I didn't know if I was supposed to be pushing or not. And then the other thing was that I had said in my birth plan that as soon as things start getting heated, or as soon as getting going, I want them to speak English. Because I can speak Swedish, but if my mind is somewhere else, I cannot focus on interpreting or translating in my head. And so, there were people that were talking to me, but they were talking to me in Swedish, and I was not able to process. And I think if they were speaking to me in English, it would have been a lot more smooth, but they weren't, except the doctor. But she was delivering, so she was kind of occupied. So it was the nursing assistant that was there speaking to me in Swedish, and I was not having any clue what was happening. Well, my husband was like next to fainting, so he wasn't helping either. And so I was just there pushing, and then the contractions just kind of like, they told me, you'll only push during a contraction. Stop pushing. Only push when you feel the next contraction. Because I was like pushing just like in between, like things were happening. So I was like,
were you feeling the urge to push even though it was outside of?
I did, and then I didn't. And then I was like, I'll just keep pushing.
Yeah.
Like, there's a baby half out of me. Like, I'll just keep going. Like, I can keep pushing. And I think because, and I don't know how it would have been normally, but I think because she came like feet first, like it wasn't that hard to push without a contraction. Like,
right,
I just did it.
Because you're not like pushing with the head, with that widest part trying to get out first.
Yeah. So I would imagine for like a normal head first delivery, the hard part is at the beginning, and then the rest of the body just comes out. And for me, it was like, oh, like the body is, on push, because that's what I want to do, and I want to get this baby out. But it wasn't. I probably shouldn't have done that because what had happened is, and so they were telling me to stop, and eventually they were like, stop pushing, wait for a contraction before you push, stop pushing. And so I stopped, and then I waited, and then I waited some more, and it was just like nothing happened for quite a long time. And then I heard all of a sudden them one of the doctors said, "Det räcker," which is that's enough.
Oh, yes.
And then it was like, okay, Allison, I need you to push. Push even though there's no contraction, just push, 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 push. And so I did, and it was, of course, that was the hard part, getting the head out. And eventually they were able to get, I pushed her out and she came out.
Sorry to interrupt. Did they remain hands off?
No.
Okay.
No. So what had happened was that, like, I probably did not do what I was supposed to do, and I pushed even though I was not ready to push. And then, but they didn't say that. What they had said was that she was coming out, and then all of a sudden your contractions stopped. So there was this period of time where, like, there was no contraction. And so I was like, I basically pushed out her body while her head was still in. And to get the head out, it's, you want to push during a contraction, and there was just no contraction. And so I had to push her out. They did not use, like, forceps. Obviously you can't use a suction or a vacuum.
Right.
So the only way was forceps or using their hands. So they used their hands, but not forceps, which was nice. But they did have to give me an episiotomy to eventually get her head born. So it ended up being a stressful couple minutes, that last period, where then I wasn't pushing anymore and there was no contraction. And so in Sweden, they typically would put the baby up on you right away. And when you're doing it like that, they actually put them up on your back. So if you are like sitting on your knees, as soon as the baby is born, they will put it on your skin. And that's typically how it goes. But because this had happened, they needed to rush her out. So I wanted to have the cord not clipped right away, but that wasn't possible. So they did clip the cord and bring her out to a room just beside, or a couple rooms down, where there was a neonatologist on call. So he came in, and she had oxygen, but she was fine. Like, there was she was crying on the way out of the room. So she was, like, totally fine. It was just, like, extra precaution that because her head was in for the maximum duration of time that they allow it to be in.
It was just like protocol.
It was just protocol, yeah.
Were they able to monitor her heart during the delivery when she was, like, literally in limbo?
I don't know. I mean, I don't know actually how that would have worked. I don't know. That's a good question.
Because I wonder, and I don't know, and now I wish I had researched so I don't sound like an idiot, but I wonder if that's one of the reasons why they don't want the head in there for so long, is because they can't see if perhaps, the cord is getting compressed. Because I think that's one of the issues, is that, like, the baby, obviously the belly button is coming out, or the cord is going to be coming out before, like, the whitest part of the baby comes out, so it can get compressed.
Exactly. Yes.
But I don't know if, like, they're able to measure or monitor the heart rates to know that everything is going fine. I don't know.
No, I don't know. I mean, I guess, would they be able to see on the, like feel the cord?
I don't know. I mean,
pulses?
Maybe if there's a prolapse. I don't see. The thing is like, I've never seen it before. So like, when the head is still in but the body's out, how much of the body is actually out of you? Do you know, like, what is it, from, like, the chest down that the body was out but the head was still in?
No, it's like the arms are out, so it's like the neck.
Okay, so yeah, I mean, I don't know, like, if they could have just felt the cord to feel a pulse. Yeah. But I haven't researched into this enough.
I don't know. It was a very short time, so we're talking, like, less than a minute. We're talking very, very short.
Right.
It was probably seconds that I was waiting. It felt like an eternity, but it was probably not. Like, it was probably very short. but they have like a timer. So it was very scheduled in how long the head could be in without having to get it out through forceps or episiotomy or whatever.
Now, did she have to do any kind of mandatory stay in the NICU, or did they
No.
just check her out and release her?
Yeah, no, she was totally fine. So it was just a couple seconds, like it was a couple minutes with the oxygen, and then my husband went with her, which is also protocol in Sweden, which I also really love, that no matter what happens, when the baby is born, one of the parents is always there. So there's never separation between parent and baby, which is fantastic, I think.
Yeah.
So Gustav went after them, and I think one of the nurses pulled him along so that they know you guys are going together. And they also had a time count of how long in seconds, and I don't know who counts this, who was there monitoring this, but they had a time count of how long the baby was away from me, which was also extraordinary that they knew.
No kidding.
Yeah, so they had minutes and seconds, in terms of baby to mom separation. So that was amazing that they actually keep this and that they know that this is so important.
Yeah, they really protect that time.
Yeah, they do. Yeah, absolutely. Yeah. So for me, it was 5 minutes that, and some seconds that she was away. And my husband was with her, and I just lay there exhausted. In total, the pushing took 15 minutes, I think.
Oh my gosh, you had the quickest delivery.
So she was, yeah. She was born at 8:30, and it was 8 o'clock that the doctor had come in to check me, and I was 10 centimeters. So it was, and then I pushed it around 8:15 or so.
That is wild.
Very fast. It was very fast, but it was a lot happening, and I really did not know what was going on. But it ended up being okay, and then in the end, she came in, and it was that feeling of my husband was holding her, and they came into the room, and it was oh my God. Such an amazing feeling of seeing her. And it was seeing her for the first time, also being held by my husband was pretty much amazing. And
oh man, especially when you get that oxytocin rush and you have all those. I still remember that feeling. It was the best feeling in the world.
Totally was. Yeah. So we just kind of lay there and she lay on my belly for forever. It feels like, which was awesome. But I would say that in terms of giving birth breech, I think I was really lucky that the team I had was so good and so qualified and experienced. And even though there's only 30 births a year, it's they are really passionate about learning and about doing it. And they know the procedure and they know the protocol. And so I felt really lucky. And even though there was a slight hiccup, they knew exactly how to handle it and how to, what to do in the situation and what's the maximum amount of time that this can, that baby can be like this and what to do directly afterwards. And so it was very I felt very well taken care of in a situation where if I was in a different place, if I didn't have midwives and doctors that were so experienced and so educated about delivering breech, that it could have been a completely different situation.
Yeah.
So if I were back home, perhaps I would not have done that route.
So I have two questions. The first is, for anyone else that either is in your shoes or might find themselves in your shoes, do you have any special advice for them, whether it's, in Sweden or perhaps elsewhere in the world? Breech baby, what's your advice to them?
Yeah, well, I think just kind of leading from that comment is that I really would recommend finding out from your person or professional delivering your baby, midwife, OB, whatever, physician, what their experience is with doing so, and not only if they're willing, but if they're practiced, because I definitely think that in any situation, it's a good thing that they are, if they're experienced, and if they have the same kind of desire for you to have a vaginal birth that you do.
Would you be willing to share a way for anyone listening to this to contact you if they have any questions?
Sure. Yeah, absolutely.
What's the best way they could reach you?
Probably through email. So maybe you can post my email address.
Yes, I will. I'll put that in the show notes.
That's probably a good way.
Okay, well, thank you so much for sharing your story and for letting me take up so much of your life. It was fascinating, and I know it will be helpful for other people because, like you probably know, and I feel like I've listened to every birth story known to man, there's just not many out there of especially supported vaginal breech births. So thank you for putting yourself out there and sharing everything you know.
Oh, I'm happy to do so.
So that's the end of Allison's story, and Allison, I just want to thank you again for taking so much time out of your evening to share your story, because I know that it will be very interesting and helpful to other people out there that hear it. And like I say at the end of each of my episodes, if you or someone you know has given birth abroad, or has sought fertility treatments abroad, or has an interesting postpartum overseas story that they'd like to share, you are welcome to contact me anytime at thebirthabroadpodcast@gmail.com, and I would love to talk to you about it. Thanks again for listening, you guys, and I will be back next week with a new episode for you.